Hi, my name is Len Johns. I'm the founding dean of the Lewis School of Health Sciences. The Lewis School was founded about a little over a year ago by Skip and Barbara Lewis through a generous donation. Starting this new position, I've been very excited because one of the things I've found out about Clarkson is that Clarkson is very forward-looking. They're very innovative. Giving back to the Lewis School of Health Sciences is important. And the biggest reason is the Lewis School is developing the future healthcare workers who will be probably working on many of us. And one of the things that's happened in the past year and a half with COVID-19 is that many of our students had to spend extra money traveling to places where they could get clinical rotations. A lot of times those rotations are very close to their home, very close to the university, but there were a lot of healthcare systems that did not accept students this year because of the inherent dangers that were there. So our students have had to spend more money traveling, possibly getting a second apartment. So donating at this specific time back to the Lewis School of Health Sciences. The way we would use that money is to provide students a little bit of financial relief for the extra expenses that they've had to incur over the past year. Over the next year, one of our primary initiatives is to develop an undergraduate program in healthcare. And this program is going to be different. If you look at many universities have a program in health sciences, which focuses on the science of healthcare. And what we're doing is we're developing a degree in healthcare, which is looking at the multiple aspects of healthcare, which will include biomedical technology, clinical medicine, healthcare management, and the public health and policy. What we plan to do is to have each of those kind of pillars around healthcare incorporated into each of the classes so that the students, upon graduation, will have a broad understanding of the field of healthcare and how those different pillars interact with each other and cause some of the major issues in healthcare. Because within the healthcare management, they may look at a certain medical issue from a cost perspective, whereas if you look at somebody in clinical medicine, they may be looking at it more, what is the effectiveness of this on my specific patient? With the new Lewis School of Health Sciences and the development of our undergraduate degree in healthcare, we've developed kind of a mantra. And what that mantra will be is become a problem solver in healthcare. And what we want to become is the destination school for students who want to become problem solvers in healthcare. And we also want to be the destination school for employers who want to hire problem solvers in healthcare. Another initiative that the Lewis School of Health Sciences is engaged in is becoming the sponsor for the local EMT community. And what that means is that the Lewis School and Clarkson, right, will be training and recertifying, updating all of the EMTs within the county for EMT. Along with that, we will also be training our students, undergraduate students in that area as well, so that our hope is that they will volunteer locally as far as EMT, being involved with the local squads, the hospital systems. But then what that also does is make them eligible when they go back home to be involved in the local EMT services as well. Whether you give to the Lewis School of Health Sciences to support some of our students in the work that they've done this year, or back to the larger community of Clarkson, part of that is paying forward to the future those kinds of efforts and those kinds of benefits that you as an alum received when you were here that supported you and gave you wonderful opportunities.